Hey, welcome to Sam Outside. I'm Sam and I'm outside, engaging in a couple moments of forest bathing, or Shinrin-yoku as it's otherwise known. The difference between forest bathing and forest therapy for me is forest bathing was originally prescribed, a nature prescription, given to folks who suffer from stress, all right? A means to manage cortisol production, cortisol management in the body, and relieve those aspects and allow focus through mindfulness. Exposure to nature has sounds, has sights, smells, has feelings connected to emotions as well through our body, through our senses, that reduce stress, promote calm, creativity, better sleep. All of these things relate at its core to overall wellness, all right, to health. Forest therapy is where a guide, a certified forest therapy guide, will prompt invitations to help through different means of processing using the senses through a deeper connection of nature exploration, nature immersion, and engagement with self and others, right? There's a huge social aspect to it as well. And some of the research is showing that the benefits of a guided forest therapy walk go beyond the social. It has a lot more to do with how the practice is. It's a slow walk, right? We're not putting in steps, and the key is to introduce the healing elements of nature through exposure to phytoncides, which come from coniferous trees primarily. So there's those aspects of those volatile chemicals interacting with our own body's immune system. But in forest bathing or nature connection, there are possibilities where the participant or the practitioner can simply find a moment, sit quietly on a balcony, in a garden, on a lawn, in a park, and experience a nature connection through that act of 20 minutes 3 times a week, or a 2-hour experience once a month, or 5 hours through the month. Those are the recommendations. That's the prescription. But it's the act of moving through the forest on a guided walk, right? By slowing down the pace and the invitation to do different sensory work allows for these to be engaged. There is so much science, so much benefit to participating in using our eyes in nature. That's why the walk, in a slow walk, is the key to the success, or one of the many keys to success, all right? Walking in nature does, and slowly by the way, does promote lateral eye movement. And for those who suffer, who are diagnosed with PTSD, with trauma, depression, anxiety, to the point where it affects their well-being, right, the course of their lives as it relates to work, social connections, other habits. Lateral eye movement has been proven to calm, reset, and focus, right? It has to do with our brain. It has to do with the 2 hemispheres. One of those hemispheres very much in control of the logical side. So we're dealing with mathematics and spatial awareness. While the other side is more their creativity, language, emotion, things like that. So lateral eye movement, the direct, constant scanning, which takes place when we're walking more slowly, the lateral eye movement does shift hemispheres, connecting logical, right? Brain's just automatically doing the math, perception, awareness of our situation in the natural environment, our scope, our scale, how small we really are, how special and short-lived our existence really is on a non-conscious level, relative to the emotional side and the creative side of how diverse and unique and special all the living matter is. Primarily it's vegetation, but those 2 aspects are constantly happening on a slow walk, that lateral eye movement. Now, practitioners of lateral eye movement therapy or treatment are inviting patients to participate in lateral eye movement activities while communicating events, reliving events of trauma. And the lateral eye movement during those sessions does promote and activate the brain's ability to be very specific about the actual events, rather than focusing solely on the left or solely on the right, where there might be more creativity, more emotion, more exaggeration, which honestly the human brain is not great with memory. All right, we put so much emotion to that. There's so many other triggers that can change, whether it's a sight or a sound or a lack of sound, whether it's a place or a person, a word, a song. There are so many triggers for that. But by participating in EMDR, right? Eye movement. Sorry, I forgot the words. EMDR therapy, eye movement, desensitization, and reprocessing. Reprocessing the significance and the impact of that event as it relates to the continued relevance on the current situation of the life. And using both hemispheres through lateral eye movement is one strategy, one coping, one practice, one theory that helps promote healing and acceptance and the ability to still manage that trauma in everyday life. Walking slowly in nature requires lateral eye movement. Any forest therapy guy can invite prompts, practices where, the slowing down and really noticing what's around you, right? There are many aspects of forest bathing and forest therapy. Well, yeah, there are times where we're inviting participants to sit quietly for 10, 20 minutes, sometimes a half hour or more, and that has its own individual benefits. But it's the lateral eye movement through a slow walk, through a natural environment that connects differently to emotion, through lateral eye movement that unconsciously allows for scope and scale, creativity, appreciation, gratitude. So all those things come with a slow walk, which might be a different practice than if someone were simply invited to participate on their own in forest therapy, or forest bathing, or Shinrin Yoku, which could be, the entire practice could be without much or any distance covered at all. So when people are out on a walk down a road, sometimes with others, and when we walk with intention at a quicker pace, our eyes situated in our skull are forward, right? We have predator vision. So that doesn't allow for much lateral eye movement. So slowing down the pace, being invited to look around and notice, right, all the way around, engaging both hemispheres in a safe environment, safe situation of our own control, of our own doing, does promote a very different kind of healing through nature immersion. And of course, those smells, the sounds of birds, sound of water, sound of wind, the feeling of air passing over us, and sharing company and making relative connections with other living things in the human world do promote and elevate the experience of a guided forest therapy walk to much higher levels of healing and connection. And that is the power of forest therapy. So lateral eye movement has so many benefits, comes with a slow walk in nature. All right, so it's more than just focusing on the path, which is unfortunately how most people navigate the natural world, being very aware of their own safety, not wanting to trip or fall, suffer injury, right? But slow down. Practice some mindfulness, engage the senses, and make an effort to promote lateral eye movement. All right? It's a form of therapy, and it works, and it's promoted and shared while out in nature. Right? So a little bit of the science that is proven and backed up by spending time in nature. Do it slowly, do it mindfully, Do it often. All right. Thank you so much for spending time with me and sharing. Please go outside. It's good for you. All right. Slow down. I'll talk to you again soon. Bye-bye.